One topic that I am very passionate about is nursing. I currently work in the nursing field, and there are many aspects of my job that are important to maintaining the well-being of my patients. One of those being perineal care, otherwise known as pericare. This is usually care that is provided to patients who are incontinent of either bladder or bowel functions or even both. Pericare is the act of cleaning the genital and anal areas with any sort of cleaning agent such as soap and water, continence spray, or peri-wipes. Pericare is usually given at least once a day or more if the patient is incontinent, in which it would be provided upon each time the patient needed to be changed. If the patient is not incontinent, pericare is still provided just to maintain good hygiene, and this can be done by either a caregiver or independently by the patient depending on their needs and limitations. Pericare is usually done during daily bathing, after using a bedpan or urinal, or going to the toilet, just to ensure that the skin is not going to be compromised by the effects of urine and bowel residue. If residue from urine or bowel is left on the skin, it can cause skin breakdown or infections such as UTIs, blisters, rashes, and skin ulcers because the skin integrity is compromised. One specific skin infection caused by moisture associated with incontinence is dermatitis. Other than providing regular perineal care, to prevent these infections, a healthcare provider can apply barrier or medicated creams to the genital areas, especially once redness occurs, to ensure that it does not get worse and turn into a sore or blister. Making sure that a patient is clean in the genital and anal areas is very important, especially if they are incontinent, because this is where most skin issues occur, and maintaining a clean peri area is the first step to prevention of compromised skin. While patients are in the care of a nursing staff, skin assessments and evaluations play a big role in their well-being, therefore making pericare a very important part of a healthcare provider's job.